am Dr. Sudeb Mukherjee, an interventional cardiologist currently practicing in Kolkata. Today, I'd like to say a few words regarding management of hypertension in diabetes patients. Hypertension and diabetes mellitus are two of the leading lifestyle diseases in the Indian and the South Asian populations that often coexist due to overlapping pathophysiological factors. Obesity, insulin resistance, inflammation, and oxidative stress are thought to be more common pathways. Up to 50% of hypertensive cases in India are diagnosed with type 2 diabetes mellitus. The recent guidelines provide comprehensive recommendation for the managing hypertension in patients with diabetes. As per the Indian guidelines of hypertension, it is defined as systolic blood pressure of 140 millimeter of mercury or more and diastolic blood pressure of 90 millimeter of mercury or more. Therefore, it is very mandatory to keep your blood pressure in the targeted level. Primary hypertension is mostly asymptomatic, while secondary hypertension is due to various underlying pathologies. Therefore, you have to keep both the factors in proper recordings so that we can treat your high blood pressure and can make it come down to the targeted, optimized lower level. It has been seen that over 1 billion people suffer from hypertension globally, which is expected to rise up to 1.5 billion by 2025. And 50% of such cases are also diagnosed with type 2 diabetes mellitus. Therefore, it is a major risk factor for development of heart failure, other cardiovascular diseases, chronic kidney disease, peripheral arterial disease, erectile dysfunction, and end organ damages. There is a complex cause-effect relationship between these two disease entities, which predisposes the patients to increased risk of cardiovascular complications, which is fatalities and morbidities. For patients with diabetes mellitus and hypertension, 24 hours ambulatory blood pressure monitoring is recommended to maintain a blood pressure targets of around 120 by 80 millimeter of mercury. The use of aneroid sphygmomanometer must be preferred over digital devices. However, for digital machines may be preferred for home-based measurements. Blood pressure thresholds may vary with age and comorbid conditions. Non-pharmacological management are always preferred. That includes lifestyle modifications. Along with that, low sodium diet, physical activity, and healthy diet are recommended to manage hypertension. Along with that, patients will definitely need, when it is off target, pharmacological intervention. That includes a lot of good drugs that we have currently to treat your blood pressure, to maintain your blood pressure in the targeted level. Angiotensin receptor blockers, ACEi inhibitors, calcium channel blockers, diuretics, beta blockers, all are used to treat your blood pressure depending on various indications, your underlying comorbidities, your underlying disease, so that the blood pressure can be achieved with a targeted optimal level. Therefore, hypertension is a strong modifiable risk factors for the macrovascular as well as microvascular complications in diabetes. Strong evidences from clinical trials and meta-analysis supports the targeting blood pressure reduction to at least below 140 by 90 millimeter of mercury in most adults with diabetes. Lowering blood pressure may be beneficial for selected patients who are suffering from high cardiovascular disease and risk. And if it can be achieved without undue burden, and such lower targets may be considered on an individual basis. In addition to lifestyle modifications, multiple medications may be needed to control your blood pressure. With this, I conclude today's topic. Thank you very much.